So, hello everybody. I just wanted to say a warm welcome to the first of our very many podcasts to come. I wanted to introduce myself. I am Dushanti Cole. I'm the Clinical Education Lead for Nursing Associates at CPFT. And I'll hand over to my colleague Tracy.
Hello, and I'm Tracy Good, and I'm the Nursing Associate Coordinator for CPFT.
And so today we have a wonderful opportunity, and as mentioned before, this is the first of hopefully many podcasts to come, but we are featuring today our trainee nursing associate, abbreviated as TNA, and introducing Noel. So on this podcast, we're really excited to introduce Noel Howard. I'm not going to spoil the initial journey behind Noel's early life and career choices. Instead, myself and Tracy, who you've just met and was introduced to, want to tell you how and why candidates like Noel are invaluable towards a growing nursing workforce. So what makes Noel stand out in general is his passion, enthusiasm and drive towards his healthcare career journey. Noel, like many others, had looked into the role of nursing associates, but took a leap of faith to start the programme and talk openly about his career so far. So it's our pleasure to introduce Noel Howard, currently on the Nursing Associate programme, who started his course and became an apprentice with CPFT in January 2022. He currently works at the Peterborough Borderline and Neighbourhood team. So I'm going to hand over to you, Noel.
Hi, and a very warm welcome, everybody. My name is Noel, as I've been introduced, and obviously today just want to give you a little insight to my life and how I've ended up here today being a trainee nursing associate. As I said, my name's Noel. I'm divorced and have a beautiful 15-year-old son. I was born down south in lovely London back in 1975. And I grew up there with two wonderful brothers and a sister. My early childhood was extremely tough, and it's probably what has sort of pointed me in this direction in life. As I was in and out of hospital due to having really bad eczema and asthma, this was really my first taste of sort of knowing what it's like to want to help others, especially in their time of need. My dad worked for a large clothes retailer as a buyer, and my mother actually worked for the NHS for 40 years as a domiciliary physiotherapist. And for those sort of unaware of that side, she actually went out and did a lot of home visits, which I occasionally joined her on as a young child. And we often went to find my mum after school at whichever hospital she finished up at to catch a lift home, because it was certainly better than walking. School was another tough environment because I was unfortunately in and out of hospital for nearly 10 years. This unfortunately made my primary school education very sporadic. And it's really tough, in life when you don't start on the right foot. And I know that goes for a lot of us out there, but, it's important that you persevere. And what it did was it really hampered my early social skills and my ability to communicate well. But I was really fortunate that I went on to secondary school, and I went to a boarding school. Probably wasn't initially my idea of a first choice, but it really made me the person I am today. I like to think I'm tough and resilient, and I'm certainly determined. And they taught me that, life's not easy. And if you want something good in life, you really need to work hard for it. And I think that's important in everything that you take on. And so my early life, my childhood was fun. I had great parents and we did lots together as a family. We were camping a lot of the time, which was a regular thing. And we spent many weeks in the summer in France, mucking around both, on the campsite. And we also had a boat, which was very cool. We all learnt to swim and sail and water ski as children. And the sun and the sea was amazing for my bad skin. Although the first few days were a little torturous, as for anyone with bad skin will know that salt water and open skin is like having an acid bath. Um, but you know, my 80s teenage years were a real contrast. We moved out of London to the wonderful sleepy town of Stamford in Lincolnshire, and my mum went to work at Peterborough Hospital. I learned to drive in Peterborough, which was a bonus because obviously learning to drive in London is certainly a little harder. And it was an absolute doddle. I also took my bike license as I have a massive passion in motorbikes, and along with all of the things that I enjoy, both water-based and loving gardening as well. So I moved up from the big city and into the countryside. It was a massive shock to the system. That's a very honest approach, but I loved it. I loved being outdoors, the big walks, having a large garden, doing lots of things you just couldn't do in London. Gardening was an early passion, which I still do today, and I also grow a lot of my own flowers and vegetables. Competing, you know, with your older siblings was always a tough thing to do, and I often lost out to this due to physicality. So I started to choose other things that they didn't do in order to be different, and I suppose eventually in my own head better. This certainly helps with your self-esteem. So the things of taking up like motorcycling and landscaping became my hidden talents. And that was really my early life. And then I suppose something I wanted to sort of talk about a little bit was what it's like being sick. And I think when you work in the NHS and you work on the sort of the front line of care, it's really good to maybe understand this, whether you've been ill yourself or you know friends or family that have unfortunately had an illness. The beauty of being a sick child is you actually don't know any different. Um, and I always had the problem as I do today. So I don't really know a day without it, and I just accept it. I do have some bad scars, over the years, and I've had bad infections, and my parents have been told some pretty bad things to prepare for, which can't be nice. And as a parent myself, I certainly wouldn't want to enjoy those conversations. But on the whole, the one thing I've been told numerous times by many a doctor is that I'm very lucky. Um, and it that goes with me everywhere I go, because you can go round in life feeling like a victim, or you can flip it and you can feel lucky. And it is such a release, to feel positive and good about yourself. My biggest challenge is my love of animals. Unfortunately, they're not the best things when you're slightly hyperallergenic and have asthma and eczema. But with a lot of antihistamines, I sort of get over that one. A lot of my animals in my life today, I have 3 poodles, I've got 4 cats, an array of chickens and ducks. Um, but I do have to take care, and I do take regular medicine and enjoy these luxuries. And the thing I think about most growing up, being a sick child, and I suppose now a hidden sick adult, um, is that many treating you in the NHS unfortunately don't understand what it's like to have these afflictions. And I do believe that this is a fundamental flaw sometimes in really understanding our patients. I'd love it if a lot more of those caring for people understood, either personally or certainly through friends or family, how these things feel. And that's really me, a little bit about me being sick, but sort of moving on to slightly nicer topics. My uni life, and work life. Well, I loved university first time around. I was studying hotel and catering in Norwich, which was awesome. I got started in catering, doing a BTEC at Stamford College when I left boarding school. I got to work around the world in some amazing hotels and spas and restaurants. I ended up working in the City of London for many years, doing something called director dining, which, as I like to say, is a bit like being Alfred to Batman. There's a lot of senior people in the city who basically need a butler 24/7, and that was principally what I was doing. It was difficult to settle down and have a family in this type of work environment. Long hours, split shifts, lots of weekends, and very little time off. So I decided to try and go into a more 9 to 5 job, which was a state agency. I had some very funny times and stories from this episode in my life, but I had no desire to really stay in it. My family life took a dramatic change, and I unfortunately ended up divorced at 40, thinking, God, what the hell am I going to do now? I had a few extra health issues, mainly my mental health, and I was certainly lost for a while. Money had always been a massive driving force in my career, but do you know what? I was no longer interested in that. So, sort of with this new vigour and wanting to do something worthwhile, I decided on a complete career change and went and trained with Patient Transport Services, or widely known as PTS as it's often known. And this was my first step inside the NHS, and I absolutely loved it. I joined the NHS in 2015, working in partnership with G4S in Kent for the dialysis transport team. This was a brilliant career change for me. I was learning new skills, driving ambulances, being respected, and going home feeling like I'd actually achieved something meaningful every day. And the patient thank yous are definitely the best. I went on and joined South Central Ambulance Service in Berkshire as an emergency care assistant on the ambulances. Again, this opened my eyes to the sheer spirit and dedication normal people go through every day to save people's lives for nothing more than a thank you, or just to know that these people are all right. I then moved up to the East Midlands to the ambulance service here as a medical technician, and I saw a more rural approach to life saving. This involved a greater emphasis on thinking outside of the box, and we were at times a great distance from the nearest hospital. After 7 years working my way through the structures within the ambulance service, I was very keen to change and get a broader insight to healthcare. I was keen to stay in the field but learn more how to care for the long-term sick and see the progress these patients can make. So I embarked upon becoming basically a district nurse or maybe a community nurse practitioner. That's my goal. I love diversity, and being at the coalface and the community nursing team is a fantastic place to achieve this. I went online to the Royal College of Nursing and through their information started to inquire more locally, and a chance encounter with a senior nursing manager in the ambulance service put me in contact with CPFT, and here I am. So why did I choose to be a training nursing associate? I was looking into two possible paths, and I saw the training nursing associate route on a website through CPFT and Adam Brooks Hospital. I felt that it was a little way to drive or commute, but I was willing to do this for the chance to change my career. After talking to Adam Brooks, I was then informed that ARU, or Anglo-Ruskin University, was also running an apprenticeship programme and had campuses at Chelmsford, Cambridge and Peterborough. And it was from hearing this and I looked further into completing my studies and working in the Peterborough area. The TNA route really interested me for a number of reasons. First, it was a foundation degree and a shorter 20-month course. Secondly, it was an all-round apprenticeship, so you could go on to specialise in a huge variety of specialities within the NHS, and not just adult nursing, like in a standard nursing degree. And third, and finally, the fact that we were all going to be registered clinicians. It felt like a win-win and an opportunity to get a good taste of what's to come in a career in nursing without feeling like going straight into the top on day one. Another aspect which was, and after consideration, was that we could top up easily to a registered general nurse afterwards, should we like the opportunity. And if you put all of this together with the fact that we're also getting a salary, what was not to like? So what's my path and where am I going to go? Well, So I'm 47 years old and I've embarked on a career to be a nurse through an apprenticeship scheme with Cambridge and Peterborough Foundation Trust. It is run in conjunction with Anglia Ruskin University and it's been a whirlwind of an adventure so far. I'm actually now 5 months in and loving every minute of the challenge. I essentially have 3 jobs. University is one, my base station, which is the community nursing team, is another, and then I go on my university placements, which is a third. My working week is a mixture of all 3, and it is certainly never dull. I regret not doing this sooner, and maybe having a little more youth on my side would have been nice. I am determined to get to my goal. The support I get is fantastic, and there are so many nursing adventures to explore. I suppose from those early days of being in hospital and my mum working all those years for the NHS, it was only a matter of time before I joined and saw my future caring and looking after the community I live within. Would I honestly have predicted I'd be doing this? Honest answer, no. But despite the struggle sometimes with money in this chosen career and the long hours, my life is simpler, more fulfilled, and my mental health is excellent, all because a simple life is an easy life. And most of all, I realise every day how lucky I am despite the afflictions I suffer. And I would just like to say thank you. And that's my journey to being a training nursing associate.
So I want to applaud, and my colleague is. We're really delighted that you could join us today and talk us through your personal journey, your history and the context behind why you've chosen this course and where you're at currently with the early days of sort of planning it into your life and settling in. I think lots of people out there will take a lot from what you've said, and they will be inspired, hopefully, to look at an opportunity working at CPFT, being an apprentice, starting the nursing associate program, or just be inspired to work in healthcare. Tracy, I don't know if you wanted to add anything in terms of what you've heard today.
I don't wish to add anything, but just say thank you, Noel, for sharing that and for sharing your personal history with us. That was fantastic. Thank you.
You're both very welcome.
So that completes the end of our first podcast. We look forward to catching up with you soon. Take care.
Thank you. Bye-bye.
Bye-bye.